we're talking about the triad, where basically what they've always taught us in school is, like, you have you're on a coagulant or something that's going to like a birth control. So we know oral estrogen increases our risk of clotting. There has been an injury of some kind to our endothelial lining, surgery, whatever, and you're not as mobile, and so that like triad increases our likelihood of having some sort of clot. Usually it's someone had a deep vein thrombosis. We're usually
Mhm.
not going to a stroke. I've also had examples where women in their 40ish or something like that have actually had a genetic um, abnormality of their heart that was never found, where they had a PFO, there was a hole in the heart, and they had a clot. They actually had a stroke because of that. Again, that's a pathology that caused it. And yes, you were on like you had a something that was going on that increased your likelihood of clotting. Was it the estrogen? We know in the studies that say that topical estrogen does not increase our risk of clotting. But they will say like, nope, you've had a clot, you can't ever take estrogen, which is not the case. You should not be on oral estrogen. You can be on
Right.
topical. You can even use, like, the vaginal estrogen ring, just like nothing, no estrogen going in the mouth. So there's a lot of, non-correct information out there. I would
Mm.
say that, like, unless and this may not sound correct, but I've just seen it so often that, like, unless you have actually gone like, had training in hormones that you really don't know, and, like, I would say, generally speaking, a lot of primary care do not like hormones. They're not comfortable doing it, so don't see your primary care for that. Like,
That
um
yes, that makes sense. So, let me back up and ask a question then. So, you can not oral estrogen, but there's the patch, there's creams that women can take, and that's really a discussion between the patient and the provider. So, whether it's you or another practitioner who understands hormones, and I guess just to clarify for the people watching and listening, how much training do off the top of your head, do you know that doctors or primary care doctors receive when it comes to hormones, or is it really something they have to seek out to get the most current information?
I would say, like when you see all that stuff on TikTok, like all the things like on Instagram, TikTok, when they talk about that, like the formal training with like hormones or perimenopause, menopause, I would say, yeah, it's pretty little. The exact amount, I can speak for myself as a women's health nurse practitioner. I got my 4 years of undergrad, a graduate, became a registered nurse. Was there? eh, This was a long time ago too. So you're like, do I remember learning about hormones? Not particularly. Like I can't recall.
Mhm.
As going back to school, to become a nurse practitioner, to get my master's, it was like 3 years. It can take longer or shorter just depending on how quickly you can do
Life.
it. Um, yeah, life. I would say, like, you spend a fair amount of time, like, you learn about the menstrual cycle and what is happening. I'm trying to think, like, I would probably say, like, of the 3 years, probably a year of, like, because my degree is women's health, so, like,
Right.
did I l did I learn the menstrual cycle? Yes. Did you learn, um, like, the how this is supposed to go? What is the normal? So then you can recognize the abnormal. But I would say also, one of the reasons that helped me immensely was I that was my, like, field of choice or study. Like, I didn't
Your
really recognize
focus.
it as my focus, but, like, in order to graduate, I had to do a big presentation, and I chose vaginal dryness, the use of, a medication to help with vaginal dryness, and so, like, I literally had to present. I had to know, like, you just have to be prepared for anything and all the questions, so I
Right.
spent a lot of time understanding that, but so I would say, was that on my own? Yeah, like, I had to do a lot on
Mhm.
my own, and doing like the Northern American Menopause Society, like doing training there, you do spend a lot of time on your own with that. Now, I'm also going to say this because this is the reality of life. Most of us in any profession, if you want to become an expert in a particular part of it, you're doing that on your own. Like
Right.
there is no way that I could graduate with my master's in women's health and gotten all the training I needed when it comes to just to menopause or perimenopause, right?
Right.
So it is what you seek out and what you enjoy, and, like, this is going to be more of my focus. Does that make
Well,
sense? Like, we
yes, totally. And also, you're not offering orthopedic advice to your
right,
patients because that's not your field of expertise. And I say that because, I think we have been raised, our generation, the generation definitely before us, of just having this blind faith and trust in our medical professionals. I just think now that we know more, we can ask harder questions, and that you are human, doctors are human, and they may not have all the answers. And that doesn't mean that it's bad or that it's wrong. It just means they don't have the answers. And to seek out a different opinion or gather information and really take accountability within yourself to do what's best for
yeah,
you.
right. Yeah, yes, I think there's, like, a two-part, like, with that. Like, it's hard because, like, when you think like, when I think about stuff like, I don't know how to fix my dishwasher. Like, I'm going to hire you to fix my dishwasher. I can troubleshoot some, YouTube is available, I can fix some like, some things, but I do have an expectation of you coming in and fixing it, right? So there is that combination of, like, do I know more than an architect when it comes to women's hormonal health? I like to believe I do. I hope I do. Um, I think it's discussions, right? So there's this like fine line of there is so much information out there, and there is so much um, good information, bad information, but information. And so I think that there's that balance of like, for me, I think as if I did not do what I do for a living, I would never, you shouldn't take people's blind, like, this is what they say,
Right.
like I think you should come into it with questions even if you're not sure, and, like, if something doesn't sound right, question it.
Mhm.
I think as women, we are more like, "Okay, well," like, it's okay to ask questions, and I think my biggest thing I always tell anyone, I'm like, "Whether you're working with me or not," I'm like, "Ask why." And if you can't get
Yeah.
an answer as to why, then maybe that's not the correct provider for you. If someone is just blind, like, telling you, "You should not be doing that," like, I'm not your freaking mother. Like, that's something you say to your kid. Like, do you know what
Right.
I mean? There is a definitive sometimes, like, yes, no, but, like, even as your children grow, it's not a yes, no answer anymore. Like, usually I'm not asking permission anymore as a 20-year-old. I want, like, so, like, things change, but you should be having an open discussion as to, "I think you could benefit from this, and this is why. What do you think?" Or what feels comfortable for
Mhm.
you? Because that's always gonna be a thing, but I think as providers, when we just tell people, "No, you shouldn't do that. No, you can't do that. Yes, you have to have a mammogram." No, you know what I mean? That sort of thing. I'm like, you are responsible for yourself." And societally, like, we don't al like, we wanna it's someone else's fault, like, we don't wanna do that. When you brought up the thing, I was like, yeah, I would have loved to been being a practitioner in the '80s. It's like being a cowboy. Like, what there was no internet. People just kinda were like, "Okay, well, this is what they told me to do. I'm gonna do it." Like, like, that kinda sounds nice. Because now you have people coming with you and you're like, "Have you heard of this?" And you're like, "No, what the hell is that? I don't." But
Yes.
I'm always learning and you're trying to keep up, and like, I try to limit my time, but, you do get on TikTok and you're like, "Oh, what's that? Should I be doing Oh, that's an ad." You know what I mean? Like,
Mhm.
so it's hard. It's really hard. It's hard to navigate.
Well, and I think people speak with such conviction that,
Mm,
like, if you have the confidence and you know it to be true and you speak your truth and you're on a social media platform or whatever, it's easy to believe that if the person receiving it doesn't have the same conviction or understanding. And
yeah.
so, what would you say to anyone listening, like, where do you start? Because it's overwhelming. And if you're starting to feel like, oh my God, I'm sore, I don't feel right, my cycle's irregular, like all the things, and you're overwhelmed with information, where do you start?
I mean, there's a couple things that you can do, but I would say, like, okay, so we know, like, and people have heard this, I feel like, numerous times, like, perimenopause can start as early as 35. Like, we like to categorize things. So, like, we can have early perimenopausal symptoms. Then we can have, like, kind of like you're in the perimenopause, like, appropriate age, which somehow tends to be like 40. And then it can be like late perimenopause. and then it can be like this transition to menopause, and then you're in menopause, and then you're postmenopausal. Um, but that being said, like, hormonal imbalance can happen at any time of our life, and so our bodies like to stay in a it likes homeostasis, like, it likes to be in balance, right? And so it's gonna try to always stay in balance, and things will throw us out of balance, and it can be a physical stress, an emotional stress, it can be, like, something that you would think in your mind, like, it wasn't that big of a deal, but I moved. Like, that's a lot, there's a lot going on. So, again, if you kept in, like, I had a physical stress or did I have an emotional stress? Did I have a baby? Did I have a loss? Did I have a
Mhm.
personal loss? Like, did I have a miscarriage? Did I decide to have a termination? There's so many different things. It can be as simple as like, I broke my leg. Like, that's a stress on your body. And you hurt your yeah. That's a stress on your body. And how is my body going to respond? Everyone comes to it differently, right? We all so again, I guess I'll stay focused on hormones is hormone imbalance can happen at any point in time. And sometimes we need a little help just to get it back on track, whether that's like we got to focus on nutrition, we got to focus on sleep, we need to help you process some of the stress, whether it's like working with a therapist, we can get things back on track. Maybe we do need to use some hormones or something like that. And it doesn't mean like you have to do this forever. Um I guess to answer your question, that was it's lab work. It's the combination of both. It's putting the 2 together. Labs mean nothing to me unless I am talking to someone sitting in front of me. I
Mhm.
can interpret them and I can make a like this hey, based on these labs, I'm looking at this looks like a postmenopausal woman. This looks like a perimenopause. So I always like when I get lab work, I always talk to I'm like, I'm gonna talk to you like I don't know anything about you. And I'm gonna tell you what these labs are telling me. But then I'm always like, but I do know you, and you have told me this. So based on these two things, this is where I think we should start. I could be wrong. This might not be the right. It might, like, but this is a good place to start, knowing that we could kind of incorporate things in, and make changes along the way, and knowing our body changes all the time. That's the shitty part about perimenopause. It not
I
not not only does it suck, not only it sucks for you and going through it as a provider, it's a constant juggle and change, and like this is working and this worked for 6 months and now it's not, and it's like, yeah, I know. Like,
Yeah, it's like a
um,
moving target.
it is a moving target. I usually tell people, I actually all the time. I'm like, listen, if you are a recipe follower, you're gonna hate this because you like to like this is the recipe. They said to put a cup in. I'm putting a cup in where I guess that would be the thing. You move to Colorado, you're at altitude. Like now, the flour that I was doing at sea level, like I have to make adjustments here. Um, and that's how perimenopause is. Like these are the ingredients. I have them for you and we're gonna have to play with it. And I think the
Adjust to
big
taste.
just yeah, exactly. You know your body better than I do,
Mhm.
and you need to listen to that and make adjustments accordingly, and kind of go from there. And that's the hard part, is because you'll be fine, 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 and then all of a sudden not. Menopause. I'm not saying menopause is easy. I'm saying it's consistent, right? You know what I mean?
Right.
It's consistent. And so, like, that consistency is easy to work with,
Mhm. So,
like
I thank you, and I just another idea. So I feel like once you start your perimenopause journey, whether it's, um, conscious or subconscious, there's also this side tangent of, like, an awakening, of, like, a, "Man, how come I, as a woman, have been told not to trust my body and told not to trust my intuition? And there's like this tug of like, but wait, my body does know. So I guess if you could speak a little bit to it's not just like the hormone and HRT is a tool that can help you feel better, but there's also this other piece of it, of this, like, knowing as you make this transition and this beautiful, like, we were speaking earlier, like, women are the creators of the universe. We birth humans. Like, we are here for more than, just birthing humans if we choose to birth humans. But
Right.
there's this whole other piece of it that I think is just you can't speak to one without speaking to the other. Does that make sense?
Does, and I think I don't know, to answer your question, it's like it's our like, it tests us we gotta start younger. We have to be doing a better job with our young girls, and I again, I feel like we're having there's like a movement, there's like a transition happening, but but, like, we yeah, like, what you're feeling is normal, or not normal, what you're feeling is real. I think that's what it is. It's
Yes.
not normal, it's real. What you're feeling is real, and, don't let anyone tell you it's not. Like, again, it's like, so many women just like, "Oh, you're just depressed." And it's like, well, that 2 things can be true at the same time. Yeah,
Yes.
I may be, but why am I like, I feel this way though, like, and I think that's the thing is we need to be having again, we need to be having these conversations with our daughters. There's this great book. It's called In the Flow by, Elisa Vitti, Vitti, I believe. Amazing to give to your teenage daughters, or like
Mm.
it might be a little much, but like as a mother to daughters and to sons, like, and to boys. Like, this isn't just like, like, it's not just about females, it's
Yes.
about our men want understand, like, men are gonna grow up and they're gonna be providers, right?
Yes.
Men are gonna grow up and they're gonna be partners. And so, like, how do I help and support this my counterpart part at like vice versa? I've had this discussion with my husband all the time. I'm like, as a society, until we figure out that we are a circle and what I can do a lot of things better than my husband, but he can do a
Mhm.
lot of things better than me. In combination, we can do anything, right? But like he's
Yes.
not better. He's not better. I'm not better. Like we're just different. And like when you come
Right.
to the table and you utilize each other's strengths, it's going to be amazing. But when we are doing that, we're always going to have this issue. And it's always going to be, like the dot to go, like we're going off on a tangent, but it's like men are like typically, not everyone, but men are inherently stronger. Like just because you can be physically stronger than me doesn't mean you're better,
Right.
right? So to go with the fact of like teaching our young boys, teaching our young girls, like, um, yeah, what you feel is real, and now what? Like,
Mhm.
how do we move forward with that? And again, I like the book. I've like read, it's very intuitive. It's in the flow. It talks about as women what our cycle like, what it looks like, what it does, why we feel the ways we do when we do, and what we should be doing during that time frame. And again, I
Mhm.
was like the essential part of like hormones is there is a time to rest, there is a time to play, and there's time to get shit done.
Mhm.
Just kind and just like a farmer with the field, like I don't keep doing the same thing and I don't keep trying to grow the same thing on this land. I've got to let it rest. And but when we get that every 28 days, every 30 days, whatever your cycle is, like that is
Right.
what our body like would be following that. And again, it's not just for female, it's for men to understand that too.
Mhm.
And
Mhm.
yeah, so I would say that it's like the more we can learn.
Well, and I think it also is I I hear you giving permission, like, that's okay, and I think that's another, like, yes, it's a little bit of a tangent, not really related to hormones, but it's that
Yeah.
permission, like, this time of year, the dark time of year, the winter solstice is coming up as we record this, but this is the time where Mother Nature's like, "Hey, I'm checking out. I'm going dark for a while. I'm gonna, everything's still happening below the surface, but I'm gonna slow down and enjoy the rest." And I think that's just such a beautiful cue of like, man, we are not designed to go 110 miles an hour, 365 days a year. And that leads to
Mhm.
burnout, which also exacerbates hormones. Like it's this, everything's so delicately woven together. If we can accept that or be curious about that and maybe lean into it and ask questions, then it can help determine what is best for your
Yeah,
patient.
and I think if you wanna go like that, like, we were designed for that.
Mhm.
That is the purpose. There is a reason, and, like, we need to be, like, listening to it, and I think that's, like, your intuitive intuition about yourself and all the things, right? Like, "Why do I feel this?" Like, "I'm tired today." Like, "Okay, well, then that means you need to rest." you know? And granted, like, life goes on and that we all have things that we have to do, but, like, you know what? Maybe the checklist doesn't have to be that long, and maybe this is not the time to be doing that. Maybe I should move that over here.
Mhm.
it's gonna serve me better. I'm gonna be better at it here, and in order to get there, like, I have to allow for the, like, rest and recoup, and then you're like and not feel guilty about it. I think that's the
Well,
other
and
piece
that's
of it.
scary. I think that's scary, like, if when I hear, "You know what, Diane, you should just go lay on the couch for the day," I'm like, "Oh, I don't know if I could do that because what if the world were to really stop spinning? Or what if, like, I am a very important person," which I'm really not, but I think, like, the little, inner critic inside all of us is like, "Ladies, we are not supposed to rest," and that's just not true, and I think
Right,
talking through it, either speaking with you and really kind of getting that out in the open and just having a conversation, really realize it's holographic. It's not the truth. It's just what we've been
right.
told.
Correct. I think the sooner we can have those discussions with our children, and that we are different, and that again, I'm curious to see like what my son, is going to be like. He grew up with two older sisters who were pretty like dominant characters, and kind of don't want to mess with them, and like how he will be, And I think I would say like, I so far so good, like,
Right.
but yeah, to understand that and to appreciate what females are going through and not that like things have to change and that's not what I'm saying. I'm not saying that like I have my period today so like we can't have that meeting. It's more of like the recognition for myself to be like if I can like what I need to do to be optimal is rest
Mhm.
and again there's a time and a place for all of the things and you actually if we allowed for that more we would be more productive when it's time to be productive. We can get more shit done.
Yes, because 'cause we're not burnt
So,
out.
because 'cause we're not burnt out. Exactly, 100%.
So it's the vicious cycle. We wrap up our inaugural, um, vlog or
Yeah.
YouTube post. What are the top 3 things that you want people to take away from this conversation when it comes to hormones and, all of that? What are the 3 things that you would love people
Okay,
to take
3
away?
things, 3 things. Okay, so as far as if you are like I have all these like books. If you're on the fence and you're curious about hormones and you wanna learn more and you really wanna get like an educated, easy, um, listen to, Estrogen Matters by Harvey Blooming. Someone else wrote it with them, but I can't remember their name. Get it on Audible, like, listen to it. It's not a great read, like, I love it, I thought it was awesome, but, like, it's a good listen to. That way you are getting the correct information when it comes to the WHI study, the good, the bad, what we learned, where we are now with that. I think that is super helpful. Find a provider that listens to you and is willing to do blood work. Like when you're told that it's not important, we don't need to do hormones because you're in perimenopause, it's always fluctuating. What are the other things are told? You're having periods, so your hormones are fine because if you weren't having like they're doing what they're supposed to. Maybe go like, okay, thank you, and find somewhere else because that is. I always tell people, I'm like, yeah, that's true. You're making enough hormones to have an end result of a period, but it doesn't mean you are making the hormones that you were before. And so there's something that has changed here for you. And that's where when people always ask, like, where do you want the progesterone? Where do you want the estrogen? I'm like, I can give you a general idea, but everyone is different. And
Mhm.
reference ranges based on random groups of people. I got 200 people here that went to LabCorp, and on average, this was their age, and this is where their estrogen was. When people
Mhm.
I always tell people too, when people get labs done, it's not like people are like, I feel great. Let's go to LabCorp and get some labs done today and see where this is. Educating yourself in the right spots, I would say, which I like that book. I would say getting blood work done, which is always I tell people to have it timed on the second half of your cycle, and so sometimes people need, like, a walkthrough of, like, what that looks like. When is that for women? We all have a intuition, we all have a gut instinct, if you like the chakra, you know what I mean? We have that or we have our 3rd
Mhm.
eye, like, we have a sense, and so, like, it's like, listen to that because it's telling you and stop ignoring it,
Mhm.
and so, like, this doesn't feel right, it doesn't then it's not right. It
Mhm.
just isn't, and there's times where you're just like I tell people, I'm like, "They smell funny." I don't know. Like, I don't there's times where you just don't connect with someone and you don't know why, And that's like my verbiage. I'm like, they just smell funny. I think you just need to listen to that and like trying to not put anyone down. Like there's people that have had their OBGYN for years and they birth their babies and they love them. And that is awesome. That's great. But now you are in a different spot in your life. You're in a different time. And maybe what I need now is something different. And so I would say those would be the things is like educate yourself, feel comfortable with your provider. And I guess the other one would be it's okay to have more than one person on your care team. And in fact, like no one can do all of this. Like I am not a nutritionist.
Mhm.
I can give you some ideas, but that's not my training. So have a nutritionist. I am not a therapist. I'm not a counselor. Do I have a little? Yeah, I can do some stuff, but like have someone who that is their job. And I think that's the hard part is we think we should be able to just go to one person. And I'm like, you can't. You know what I mean? Like that's and it's kind of not how it works anymore. Everyone there is a specialty. It's okay to be like, okay, I have someone I talk to. I have a counselor. I have a therapist, which helps with this part. I have seeked out a personal trainer. I want a nutritionist. I want someone helping with my hormone health. We just need more. Need to extend your network when it comes to that and get past the fact that like, okay, this is who I'm seeing. I'll stop because I could babble on forever. Is that's the hard part is the restraints of insurance and what people how that works, the amount of time you get with your provider when we are using the insurance model is small, and it's hard to get all the information, that you need or want, and you feel, like, deflated, and again, it's nothing against the provider, you can have a great provider, but they are restricted to time, and
Mm.
sometimes we have to go outside of that.
Yes, that is well said. Thank you very much, and for those of you watching or listening, if you're not already on Lisa's email address, you can go over to, um, Encompass Women's Health and get signed up so you can receive more information from Lisa each week, and we will be back next week.
Have a good one. Thanks for listening.